For many women, they hope the journey to become a mother is smooth. For Emily Sheridan Mahoney, her twins' birth story was far from it.
It's bumpy. It's quite bumpy.
Back in January of 2022, Emily had gone to the hospital after seeing fireflies in her vision.
I went in just to get it checked, and it turned out that I had severe preeclampsia. And so I had to get an emergency C-section that day. I had an issue where I hemorrhaged after. Something got missed when they did the C-section during closing. And so things came open that should not have.
Emily felt she needed an ER, but doctors wouldn't move her.
They left me bleeding for about 12 hours. When my husband got overwhelmed, he called my mother, who was a paramedic. And when she walked in, they were cleaning blood up off the floor. And it took them another 8 hours or so to finally get me into surgery to do an emergency closure.
After a week at home, Emily was back at the hospital again with a high fever and heart rate. Again, she says she was stopped from the ER.
We were told to go back to labor and delivery, and that the ER couldn't handle things like this.
Emily says it took weeks, multiple surgeries, and eventually a switch to an out-of-network doctor altogether to get her health back on track. She still doesn't understand why her pleas to go to the ER were ignored.
I don't think that they dealt with it well at all.
It's important for everybody in Colorado because everybody deserves consistent, high-quality medical care regardless of the emergency room they go to.
Kiera Hatton with COBALT says Colorado lawmakers are now considering legislation that would require hospitals care for patients that turn up to the ER, regardless of whether they can pay, if they're undocumented, or if they're pregnant and in need of an abortion to save the mom's life. Essentially, a state version of the federal law EMTALA, whose enforcement nationally, when it comes to abortion care, has been hotly contested in the years post-Roe. Hatton says this is needed.
There are many cases of patients needing to be transported from one hospital to another because the hospital is not comfortable performing the procedure that is required to treat the patient. And that works really pretty well in metropolitan areas, but in areas where it's more rural, we find patients are having to travel many hours to get to a facility where they can get the treatment they need in a timely fashion.
Emily hopes this legislation leads to a better outcome for the next woman. It's why she testified in favor.
When you're lying in a hospital bed, it becomes really hard really fast about, how to disagree, how to get the care you need, and what to do in these situations where minutes matter. There's still gaps, and we still have a long way to go.
Advocates say this bill has gotten pushback from a large insurance company, and some Republicans have voted against the measure in committee. We reached out to Senate Republicans about their no vote, but they declined to comment. The bill will come to the Senate floor this Tuesday. Rachel Krause, 9 News.
All right.